Hey guys, welcome back to the podcast. I'm really excited for today's guest. I have Dr. Justin Grabouski with Grabouski Chiropractic here in Kansas City, specifically Overland Park. Not only do I have Justin in the studio with me, but I have two good friends of mine as well who are patients of his. And he's going to be the first of many industry experts that I'm bringing into the studio to talk about their fields of expertise. And we get into a wild array of topics that his team is working on to help people alleviate many things that they're dealing with. You might think of the obvious car accident or athletic injury, but then we get into topics like perimenopause, fertility, allergies, things like that. So I think you're going to find this a really interesting episode to learn about what he and his staff are able to do and how you guys can tap into them if you're dealing with something on your own. So be sure to tune in, watch, or stream the episode wherever you love to do that. And I'm excited for you to hear what he has to say. I am super excited to have this little group here to do this. This is going to be so fun. Okay, so I should probably back up with how this came to be. So we have Dr. Justin Grabouski, who came highly recommended by Emily and Melanie, who are here. And then come to find out, I have like a trillion friends who go to you as patients. And we have more friends beyond that who are connected to you. And so I want to bring in people who can talk about their field of expertise. And as someone who doesn't go to a chiropractor, I want to talk about what you guys have benefited from. So you ready?
Mm-hmm. Yes.
Very ready.
It's going to be really fun.
Very
All right.
ready.
Do you want to introduce yourself and your background?
Sure. I'm Dr. Justin Grabouski. I practice here in Overland Park, Kansas. I am the co-owner of Grabouski Chiropractic with my beautiful wife, Noelle, who helps every single day with the business side. And we currently have a wonderful team, including Anna and Leah, our CAs, and our associate doctor, Dr. Christy Irvin.
I love it, which I got to come in with Emily to a session a couple days ago.
That's right.
Pre-podcast, so I could get a feel for what happens. Yeah.
That's not something you get to do with your friends just every day.
No.
Come watch me get adjusted.
But I do love that she did that. So
awesome.
She knew exactly what she was going to be walking into today. And you got
Yeah.
to experience our office firsthand.
Yeah, exactly, which I definitely wanted to do. And I don't know if you guys picked up on this listening to the, you guys heard the episode with Brad Burrow, who you met coming in here, the owner of Real Media. But I told him I want to know a little bit about a lot. And so I want to talk to people about all their different fields that they're in. And so that's where the chiropractic thing came in. I was like, this is perfect because who did I tell? I think it was you. I was like, I feel like everybody now is in more pain than they've ever been, both like physically, mentally, emotionally. And we'll kind of get into that stuff too. Right?
Yeah. That makes me,
sure.
I'm just like wondering why. Do you know, like, is it our age? Or is
Well,
it
yeah,
like
so-
the age in like a big meta kind of way? Like
The
what
state and stress of the world and
what
do you
everything.
think?
Yeah, probably.
I think it's probably all of the above, which
feel
I
like
want to
you
get
have-
into all of those details
Yeah.
because I think we were talking about athletes. We've been talking about perimenopause, which is definitely a huge topic right now. Got to talk about that. We all have kids. We can talk about prenatal. But did you get into it because you had an injury? Is that what I read?
Correct.
About you?
Yes.
Okay.
When I was playing college baseball, my junior year, I had a bad injury, and I saw every provider you can imagine: athletic trainers, physical therapists, orthopedic guys, injections, and it was a crazy chiropractor in Omaha. I would drive over 3 times a week during the season, and he got me in shape to play every weekend, and then I'd have to spend the next week recovering. The only reason
this
I
shoulder?
played
What was it?
it was a torn up quad and leg injury that went up to my hip,
Wow.
and that man got me playable.
He works.
I
the
wasn't
magic.
great, but he was the only one, and that I was very fascinated. At the time, I wanted to go into orthopedics because I've had so many surgeries, and so I was kind of drawn to that. And it's really commonplace in the chiropractic world to say that chiropractic chose us. We didn't choose chiropractic. Most people.
Interesting.
Some are legacy chiropractors who were born and raised by other chiropractors, but the
Generation.
majority of us went through something that then we found chiropractic for and went, oh my God, this is incredible.
Yeah.
And this is what I want to do. And that was definitely my experience.
So that was during college. Did you have to
Yes.
like pivot what you were studying, and then like how much schooling is involved with becoming?
Didn't have to pivot. I was already pretty much pre-med chemistry major for those 4 years. So 4 years of undergrad, playing baseball, having a good time. And then it's actually 10 trimesters now. You go all year round. Instead of 2 trimesters, it's 3.
Oh, wow.
or 2 semesters. It's
Emily's
3.
over there doing the math.
So it's like 3 3/3
Oh,
years.
My son
so,
wants to go
Oh,
also.
Johnny.
Thanks to,
Oh, right. Your son also goes. My gosh. There's
so he
another
wants
one.
to be one. So I'm just totaling up. I'm doing math in my head.
So 7 1/3 years. You have parts 1, 2, 3, and 4 board exams plus a physical therapy board exam. And I was actually trying to do a little bit of like updated research because I haven't looked in a while before coming on here. But you can do a Google search of the chiropractic credit hours versus the medical doctor credit hours. And there's a ton: orthopedics, neurology, radiology, clinical nutrition. We take way more than the MDs do. And then when it comes to pharmacology, pathology, general surgeries, they take way more than us.
Oh my gosh.
But it's pretty fascinating when you actually look at it and go, whoa, that's a lot more than I thought.
Yeah.
And it was. Like it's 30 to 33 credit hours your first semesters.
Yeah.
What a fascinating way to break that down.
I know.
Like,
And also,
And not
I
everybody
could
makes
never
it
be a
through.
chiropractor because I can't do math. So I'll just leave it at that.
Once you're done with school, you don't have to do as much math. So you'd be
Yeah.
all right.
That's good. Okay, so how long have you been doing it now? And how long have you been in KC? Overland Park.
16 years total.
Okay.
My first 6 years, I started off doing a little more physical therapy based type chiropractic care, and we can kind of get into that too. There's a million different types of chiropractic care. I had 2 partners. I was an independent contractor in an office. I'm still best friends with those guys. They're great guys. They treated me extremely well.
Yeah.
And they always knew I wanted to do my own thing. So when it came time after 6 years, my wife and I had a conversation, and she said, it's time, let's do it. And that will be 10 years next month in February.
Okay.
That we will be in the practice that we're at now.
Yeah.
At Grabouski Chiropractic at 135th Street.
Yeah.
So, and it's gone so fast.
What do you primarily focus on? Like, how do you explain what you and your team do?
Are you ready for that?
Yeah, I'm ready for that.
Here we go.
There,
And you guys feel free to jump in whenever.
Well,
you know,
we both
we'll
come
get
to
stories
for
from
such
you guys.
different things.
Very different things.
And then I see other people coming in and out because your office is run like the office experience is something we need to talk about.
Yeah, I want to dive into that because
Like,
I've
he
heard
has
from
these
you guys
all
and you
kinds of
how incredible it is.
I feel like we have to preface that with kind of like the most beautiful and also terrible things about modern chiropractic care, which is that we are all so uniquely different with what we do that it's a really beautiful thing.
Yeah.
You can find a chiropractor that does dang near anything,
Yeah.
and whatever you need, you can find that person. But it also creates a lot of confusion because we are all so different that you don't really know what you're walking into. Or me compared to 5 others that you would have in the same room all have a different approach, different techniques, different philosophy. So there's not a very streamlined, standardized version of
I'm
chiropractic
like, that
care
feels
in the
like a
industry.
window of opportunity for someone to figure out how you find the one that helps with XYZ.
Mostly
like-
referrals. I mean, it pretty
Yeah.
much this day and age has to be referrals.
Right.
Other people that have similar things that you have. Who do you go to? Who do you see? Who's the best? And that's how most people end up walking through our door because we don't market or advertise
fair,
anymore.
yeah.
It's all referral
You came
based.
to me through another healer who, you know, there's like this whole network of healers here in Kansas City, right? And it
gosh,
seems
that's
like
like a
you
whole
all
other
know
episode,
each
right?
other. Yeah. And you all know each other. And it's kind of crazy. So you came to me from Jillian, the myofascial / I don't even know magician that she is.
Amazing.
For structural support, right? And then Melanie came to you because I was like, he's amazing. And
Yes.
then your migraines were gone that day. You know,
Emily was referred from a provider that's in another chiropractor's office.
Yeah.
Dr. Jill, who's one of my best friends,
who I've
Yeah.
also seen and is amazing.
who does an entirely different set of things with integrative health.
So what
and
is an
nutrition
example of like
wellness.
how it's entirely different between like you and her? Like what do people come to you
Right.
for versus what Jill would come in here and talk about?
I would say the biggest things that we see, you know, first and foremost would be we're very big into corrective care.
Okay.
So we still see our share of neck and back pain, typical symptom relief chiropractic care, people who just want out of pain. But the majority of what we do now is people coming in with an existing injury or problem or condition that's been around for way too long that they're sick and tired of, and they're looking to break that cycle of pain or illness.
That's me.
And then it's
yeah.
our job, it's my job in that role to do a true assessment and say, okay, you may have pain here, but where's it actually coming from? What's the cause of this thing, and why are you dealing with it 1, 2, 3, 4 times a year for the last 10 years of your life without somebody stepping in and saying, this is what needs to be done to stop that cycle? So corrective care is huge, and that also extends to kids, scoliosis, curvature issues, your typical hip, back, neck pains.
Yeah.
But then you can go the full other realm of the prenatal, postnatal, pediatric care, geriatric care. I mean, you name it, we treat it through chiropractic. But I stick with chiropractic care adjusting patients. I don't do physical therapy anymore.
Okay.
I don't do a ton of hands-on soft tissue techniques. But the caveat to that is whatever you do need as the patient, if I don't provide it, I'm going to refer you to a provider who will give you that exact thing that you need. And I think
That's amazing.
I think the best of us, I like to think the best of us are that way. If you're in my office and you're not in my specific expertise, it's my job to make sure the patient gets exactly what they need from who they need it and ends up going through that door.
Got it.
To not selfishly keep you here under my umbrella if that's not my specialty.
Is that just you guys being Midwest nice, or does that happen
That's a good question.
throughout the industry?
Probably a little bit of both, or people that have just done it long enough where it's, you know, I can't be all things for all people all of the time.
Yeah.
I want to be a specialist at the few things that I do, and then send you to the specialist for exactly what you need.
So what did you have, and what was like your first, can you tell us like the first interaction, and you can talk to like what you have people do as a new
Sure.
So
patient?
I started seeing Justin probably over the summer sometime. I think it's been about 6 months. And what I really appreciated about you specifically was your gentle approach. I felt very safe, very comfortable. It was very easy. He did x-rays. You know, he really pinpointed what the issues were and explained them in detail, more than I really even understood what you were saying. I just trusted you. You were talking about percentages and what you can do and all the things. But I appreciated it because it showed the, you know, all the knowledge you had in bringing that to me. So I really appreciated that. And I would say after the third time seeing you, was really where I noticed a huge change. And I was pulling out of my driveway and I looked left and I could look left without any pain. And I was just thrilled. And yeah,
I
every
remember that
visit's
day.
amazing. Yeah.
Yeah.
It was a huge breakthrough.
Yeah.
And yeah.
I think we got a text about that day.
Yeah. Yeah.
I mean, those are the moments that I still live for, like 16 years later, and I
Yeah.
never get bored of those patients that walk in, and you can tell because they have a huge smile on their face, and they're like, guess what? And
Yeah.
then it's usually followed by, I did this, or I did that, or I woke up without this one specific thing that I've suffered with,
Yeah.
and it feels good to feel good,
Yeah.
and that never gets old.
Well, to your point, I was going to say, after you guys referred me to him and I got in touch with you about coming on the podcast, we met for coffee at Pilgrim Coffee, and you become like immediate fast friends with everybody. Like you are so welcoming and so warm and so hospitable. And I mean, I like that in and of itself has to be a huge differentiator for you as a chiropractor.
Well, thank you.
Honestly.
I genuinely love
Yeah.
people. I mean, I
Yeah.
truly do. I think you have your world full of optimists and pessimists, and I think
Yeah.
people are genuinely very, very good deep down, and I hope that's what
I
we
love that.
continue to attract into our practice. If you're a little bit grouchy or don't really like a ray of sunshine in front of your face every day, you may not last with me a whole lot.
You might get fired.
But, you know, that being said, I meet a lot of people kind of at a low point or at a tough point
Vulnerable.
in their life.
Yeah,
And
that's
they're
true.
not, you don't always get to see that true person on your very first day in an exam room with them. And so some people can come off a little prickly at first or very pessimistic because they've seen 10 other providers for this thing and now you're telling me
just
you can help me,
miserable.
but why should I believe you?
Yeah.
And then all of a sudden they're out of pain or feeling better and you see who they truly are.
Yeah.
And you're like, oh my God, this is a whole different person than I met the first day.
Yeah.
And that's
cool.
part of the beauty of it.
Okay, well, let's brag about you for a second, okay?
Uh-oh.
My homework on you. You've been voted best chiropractor by the Kansas City Star. Named one of the American Institute of Chiropractors' 10 best chiropractors in Kansas. And wait, there's more. And honored 9 consecutive years as one of the top 25 outstanding doctors in America. Yeah. Bravo.
I feel like I'm blushing
I
already.
can attest.
I
I mean, what is that like? What does that mean to you? I'm sure you're very humble knowing you and you guys, you know,
It's-
being with him, but like, that's a big deal.
it's very surreal because I just try and show up to work and be me.
Yeah.
But I've had some really incredible teachers and mentors in this space
Yeah.
for the last 16 years. And everything that I know, I have learned from those people. So
Are they
like,
locally or are they across
No, they're
the country?
nationwide
Yeah.
for the most part. And my main mentor that's taught me pretty much everything about the style of adjusting that we do, the business practice that we run, the flow of the office that you guys see. He's still down in Tulsa. He's retired.
Oh,
but he's
Shout out to Tulsa.
And I keep up. And I keep up with him. But
Yeah.
like, I haven't had to have any original thoughts in a long time because I've really jumped in the pockets of the people who've known what they know how to do things the right way, and they've done it for a very long time.
Yeah.
And I just soaked up as much as I could from them. So
Yeah.
the awards are, I don't know, they're very, very humbling.
Yeah.
And I try not to think about them too much.
Yeah.
But I give all the credit
The
to
rest
those
of us
people.
get to pull them out for you.
Well,
So,
thank you.
Yeah.
I'm honored.
So, okay, with you, what was your pain? Where did it come from? Was it something like years in the making, or?
I've always seen a chiropractor since I
Okay.
was 22 and living in Mexico. And where I was like a bastion of like either people running for the law or like healers that just wanted to go surfing. And so that kind of surf culture really attracted a lot of people. I first got my first adjustment when I was like 23, and I was like, whoa. And I have looked at it as like a health maintenance thing my whole life. But being a single mom, I like didn't get to take care of myself for a long time. Not anymore. Shout out to the husband though. But I
Kevin.
like couldn't go see, and I developed sciatica going down my leg because
my
I started
gosh.
lifting weights like perimenopause, like we're all told to do.
Yeah.
And just the way I was doing it was not helping my body. It was causing me a lot of pain. I couldn't sleep at night. And I went to him, and like the first day it was so much better. And then over time, like I don't have it at all. I can sleep normally now. And then also though, which I think is fascinating, I've always thought I practice meditation too, you know? The spine is like a map of the entire body, really the entire consciousness. And so I approach chiropractic as a way of keeping my like consciousness in line in a way.
Yeah.
And I think you have that poster on the wall of your office, right?
Yeah.
That has a picture of the spine. And it's so cool to take my son, Johnny, who's 17, who has all this beginner's mind, and he'll be like, whoa. So like those vertebrae attached to like anxiety or like allergies and all these things that I used to have, like chronic allergies, chronic sinus stuff. I don't have them anymore because I've been adjusted for 25, let's not talk about my age, but like 25 years or something.
No, let's proudly talk about your
let's
age.
proudly-
Right.
I'm 46 years
That's
old.
right.
And a Dr. G devotee.
As
So
I'm sitting
no.
here trying to sit up straight.
And like there
on,
are
me
a
too.
lot of great healers in Kansas City, and I've seen a lot of them since I moved back here 5 years ago. But like he's the one who sticks, right? He just
Yeah.
like his process is easy as somebody who's like got a busy life, like we all do. You go in and out. It's very quick. It's flexible. You just like have a standing time, and then so I get my healing fix, and I come back and I'm like la, like I feel so
Yeah.
good, you know. But I know if you could talk about that map of the spine, if you're interested in
No,
that.
I want
I'm
to.
not-
Yeah, I do, because one of the
It's
questions
so-
that I had was like, what are some of the obscure things that you
Yeah.
wouldn't think are related to your
actually
spine or
science.
going to a chiropractor, like allergies and some other things
Depression.
that we
Well,
wouldn't.
mental
Depression.
health.
Yeah.
Yes.
I was having not a great morning yesterday. And then, I'm not kidding, right? Just one of
Yeah,
those days,
sorry.
just like grumpy and perimenopausal
Yeah.
or whatever. And literally seeing him walking out, I was just in a really good mood.
Also,
know?
you
It
get one
just
of those
changes.
hugs, and it's like the
Yeah.
bomb hug, and you're like,
That's
I'm good.
true.
Yeah.
But it really does affect your mental
Yes.
state.
Yeah, I want to talk
I mean,
more about that
it's
for sure.
bizarre, but it's true.
There aren't too many places in the modern world where you come into physical contact with other people in a way that's intentional or healing when you really think about it.
Yeah.
A lot of people miss that. And there's a couple perfect segues in the things.
So true.
Like you asked
As I was
how-
watching Emily on Tuesday, and her leg is like flipped over, and Justin's right here, and you're like, hope you're good.
I know he is.
Hope this goes well.
I got a lot of trust.
There's
You
been
do
a
have
lot,
to trust
lot
your
of trust
chiropractor. You
established.
really do.
Yeah.
Yeah.
Because you're putting yourself
do.
in
It's
a really
such
good point. Yeah.
some weird positions.
And it's every healing profession, you have to trust the person that's taking care of you. And if you don't implicitly, then it's time to find a different
Yeah.
one, because that's the most important part of any healing journey.
Well, and I immediately think if you don't, you're going to be tensed up when you go into
You'll
the office,
hit a
and it's not
plateau.
going to
That's
work.
why I got to take that
Yeah.
pre-breath to
Yeah.
just like let it go.
Yeah.
So that I
That's
can like
right.
let you into my like aura, you know,
Yeah.
once you get in there.
If you don't subconsciously trust the person that's trying to help you heal through something, you're going to hit a plateau, and your body's going to stop you. Your brain's going to stop you. You asked in the hallway, how has chiropractic evolved?
Yeah.
And the long and short of it is it's evolved insanely rapidly, but it also hasn't evolved at all from its founding principles. And because you guys brought this up, there's the oldest chiropractic philosophy from when it all started basically states, I'll kind of like 8th grade this so I don't get too into the weeds. I could talk about this
No,
for
talk to me
hours.
like I'm a 5th grader.
He knows
please.
our
Yeah.
level. Yeah.
There are
He knows us.
basically they said, okay, there's 3 major stresses that the body is introduced to on a daily basis, and the chiropractic adjustment is designed to help with all 3 of them, and we call them like the PCE, or the physical, the chemical, and emotional stresses.
Okay.
Physical, slips, falls, accidents, posture, working on a computer 10 hours, your typical things that you think about with chiropractic
Being
care.
46, getting out of bed.
Biomechanical stuff. Yes. Every day. All of the modern day cell phones, computers, all of the things that we go through. The chemical would be anything internal or that you're ingesting that's causing inflammation or
Oh,
problems.
that's the chemical.
Things that you're allergic to, food sensitivities, medications. I mean, anything that you're basically exposed to.
Like literally anything you're eating, drinking, breathing in.
Correct. And we'll come back to that because that's the internal chart of like where the nerves go and the organ systems that you support with the adjustment. And then the emotional, which is
The world we live in.
The therapy side, right? And that's why we refer to so many therapists. The office that she came from, there are 2 therapists that I refer to all the time for that. But the physiological effects from emotional stress, like everybody's pretty familiar with that, and the problems that it causes, and the hormones that it disrupts, and the tension that it creates, and the cortisol levels that spike. And so the adjustment is designed to do all of those things. The physical, right? Removing pressure from a nervous system, straightening out the hips, getting the pinched nerve out of the way, classic chiropractic care. The chemical internal side would be more if you come into me with digestive issues, or your baby is colicky or constipated, or you're an adult with IBS, or something is happening with headaches or migraines with a vasoconstriction or dilation problem. Every vertebra that we adjust has nerves that go to a specific organ system. And if that system is hypoactive and not working enough, it will regulate it up. Or if it's hyperactive and it's going way too fast and way too rapidly, it will regulate it down. So it's all about bringing that like neutral, normal, balance, homeostasis back to your nervous system.
Through adjustments?
Yes, correct. And that's why like the buzzwords now with a lot of the chiropractic world that you see is like the nervous system chiropractors. We're all nervous system chiropractors, whether you're intentionally doing it or not. But it's really cool that people are seeking out chiropractic for those specific things. And the best way to describe some of that, like if you're an adult that has a digestive issue, you know, those nerves go to your digestive tract, and they're either causing things to move too slowly, right? There's our constipation issues, or there's too rapidly, like an electrical system that's irritated. And so you're either removing pressure to help that system come up and function, or you're removing irritation to help that system chill back out. The same can be said.
Sorry, go on.
The same can be said for headache and migraine sufferers, people with reflux issues, babies with reflux issues, asthma issues, bronchial issues, kidney function, digestive issues, reproductive issues, fertility issues.
That's one I hadn't even thought about.
Cycle problems. A ton of the female cycle is helped so much by the chiropractic adjustment as far as just cramping and pain and regulation. And,
for sure.
I mean, you name it. There's just a whole chart.
Yeah.
So
of everywhere
when
it
you
goes.
look at an X-ray and you see like someone's like, you know, their spine is like this, or, you know, that's extreme, right? To say that it's like, but like a little bit, can you anticipate the issues they might have in their daily lives
Very
or
much.
in their mental health? And then how often is that accurate then?
Ooh.
Like before you even talk to them, could you look at that and be like,
Yes.
ooh, I bet they have.
But if you don't come in for
IBS.
that, it's not something that I'm gonna like throw at you immediately.
Oh.
Right? Like if I see a crazy
why
curvature
not?
in the low back, but you're here for a neck issue, I'm probably not going to dive into a whole bunch of questions about like your fertility journey along the way. So we try and unless it comes up naturally, which it typically
Is that
does.
just about giving your patients agency in their own healthcare, or
Yes.
is that because you
Yes.
don't want to open a can of worms? Yeah.
Both.
Okay.
Both. I
Yeah,
want to
that
stay
makes sense.
focused on the thing that you are asking me to help with.
Okay, well, I'm
and
just
not
gonna go ahead.
overwhelm you, not overwhelm you with too much. Some people want
Yeah.
to know it all.
Yeah, like right now on the record.
Yes.
Please look at my X-ray.
I know. We're all here being like, tell us everything.
Help me.
Yeah.
We want to know all the
that,
problems.
That does make
Open the
sense.
can of
That
worms.
could be misperceived as like you're trying to push something
Yes.
on me, and
Yes.
that's not why I came
Yes.
here. So,
Yes.
Which is the
thinking
whole
about
stigma
aloud.
of chiropractics, right? Which
Yeah.
is not my experience, but like my
Yeah.
whole family would be like, oh.
I want to maintain healthy boundaries with every patient that comes in.
Yeah.
Yeah.
But that stuff naturally, you know,
That
you
makes
see the
sense.
charts, you read the things on the screen, or you notice something.
Yeah.
Where somebody comes in and says like, I've been a lot more regular, or this, or my periods haven't been as bad. Does this help with that? And I get to say, absolutely it does. And I'm so glad you noticed that. But better sleep is one of the very first things that most patients notice with consistent chiropractic care. That's probably what I hear the most.
For sure.
Okay. I don't get up anymore. Do you remember that was my
Yes.
first complaint? I said I get up at least 5 to 7 times to get a
This is
different
what-
pillow. Do you remember different pillow? Change my position just for that, not to use a restroom, not for all the other perimenopausal things. Literally because of my neck pain, I never get up. I haven't
This
even
is why I
told
have
you
you
that.
guys here, because you are testaments to it. So that's fascinating. Yeah.
It's the coolest part. And I mean, you could
I'm so happy for you.
Yeah, never.
you could talk about it
Amazing,
for
it's
days.
gone.
Yeah.
What else with perimenopause, since we've got 3 women in their mid-40s here? Like, is that anything else with that in particular? Because that's such a
Man,
big topic.
It's I always preface this with, I'm very lucky to be a man, right? With all of my prenatal, postnatal, pregnant patients, perimenopausal. We need a little bit of testosterone and we're great. Like, no problem at all. You ladies need the perfect balance of every single hormone plus your thyroid at specific times of the month and day. Otherwise, it's pure chaos.
Yeah.
You're correct.
Yeah.
Correct
Right.
statement.
You're such a woman-friendly
concur.
healthcare provider too. I just would say, like, I think in a world where thankfully perimenopause is getting more attention, women's health and overall is getting more attention, but it just hasn't been researched. And I don't know if it's your awesome wife or like, you know, why you have this sort of consciousness of like, just knowing that the experiences are different. It makes it a lot easier to like surrender my body to you on that table and let you like help me because I know that you understand me.
Well, thank you.
Yeah.
Did you
you
grow
for
up
that.
with sisters?
No, 2 brothers.
Good question. What?
2 brothers.
Single
See, that
mom?
is surprising.
I have a very awesome wife.
Yeah.
You do.
We have a wonderful relationship together, and I've taken care of a lot of ladies over the last 16 years, and so it's just one of those things where I feel like it's I can never put myself in your shoes, but I can just anecdotally tell you what I've learned and what I know and what I've heard. And
But again, that's a
I try to be
differentiator for you.
respectful of that.
Yeah.
I try to be very respectful.
My
of that.
lower back has been hurting. To your question, you asked,
Yeah.
like, what are the perimenopause issues? And I was like, God, I don't know why my lower back is hurting because I always come in with like something every week, I feel like, aside from the usual. And you were like, well, yeah, I mean, your hormones are probably all wacky. And so let's see what we can do to get that back in line. And then, like, you know, it all is connected. Everything. Our body is one body. Everything is connected in this one body. So, like, if we take care of the nervous system, it can do a lot of things. You know, it can help.
Well,
lot
I'm
of
just
things.
wondering how many times we're looking in the wrong direction. We're looking for a medication or we're looking for a workout or something when it could be what you do with adjustments that can attack that thing more so.
If I could design the perfect program for every single patient, it would be somebody or a few people to address like the physical, chemical, and emotional aspects of everything that you are going through. So in a perimenopause situation, like chiropractic is lights out for the aches and pains and stiffness and tension and like general stress relief for the body and the nervous system. The chemical side is very much like go get your labs done, see where you're at, talk to other providers that can help you with any type of natural supplementation or send you to the MDs if that's where you need to go to get some HRT help. Like I don't hesitate to refer to medical doctors and physical therapists and I take care of all of them in the office and have an amazing team for that. And the emotional side is like, should every single person in the world be doing therapy? Yeah. Is it accessible for all of us? No, but I wish it was more accessible for all of us.
Yeah.
Like if you want the full spectrum of health, it would be all 3 of those things in one. So
Well, and I mean, a little plug for just the world of podcasts. Like I've thought about it so much where people can get free help through podcasts that you can listen to for free. You know, there's so many therapists out there. I want to bring therapists on, obviously, in Kansas City too, to talk about that stuff. But because it is crazy that people can't all have access to a therapist.
getting better, just like with
Should be.
chiropractic care, the stigmas are starting to go away.
Yeah.
I mean, I wish the TikTok videos would stop, but that's just
Ooh, what are the
that's
TikTok
just-
videos?
that's just
Yeah,
me
what's
being
that?
me.
Are people
the
doing-
chiropractic TikTok videos?
I gotta get into TikTok more and watch it, I guess.
With like the aggressive adjusting. And
I'll look at it
microphones
today and it'll be all of that.
Oh, no.
There's a very
Okay,
like
so what should people avoid? Let's go ahead and do
Man,
some misinformation
avoid.
subject matter.
again, I have to say, our philosophy, my personal approach to everything is I'm not anti anything. I'm just pro chiropractic, and that includes medicine and the MDs and the PTs. I was raised by a nurse. My aunt was a nurse. My grandfather was the only person in our family that went to his chiropractor. and it was as old as he was. It was like these two 70-some-year-old guys like wrestling with each other. It was awesome.
That's awesome.
And if any of them, and
It's a good mental image.
so my mom would literally take me to the back door of the chiropractor if I were hurt in a football season because she's afraid she'd get fired by the medical doctors that she was employed by.
Wow.
That's extreme.
No,
And
but
it's way better,
reality.
way better now than it used
Yeah.
to be. But I wasn't raised in a chiropractic paradigm either. And so it's, but it's come a long ways. So I'm not anti anything.
Okay.
I just wish everyone would be extremely thorough compared to what the industry standard is and a little more careful. And for every video that people post where you're seeing this aggressive chiropractic style to like impress that small percentage of people that will sit there and watch it on TikTok all day, can I swear on here?
You can.
You're scaring the shit out of somebody else
Yeah.
that probably shouldn't be seeing that. And I tell the young docs all the time and the students all the time, if somebody's watching you do that style of really aggressive adjusting, how likely are they to bring their child or their baby or their 98-year-old great grandmother in that needs your help? They're probably going to hesitate and be like, whoa.
Yeah.
And they may not even know that a different style exists out there that is more gentle, that's designed for those people.
Yeah.
So I always try and teach that to the younger docs and existing docs. Like, keep in mind who's watching you do the things that you're doing and who's like, okay, I could do that, or my spouse could do that, or my grandma could do that, or my kids would benefit from this.
Yeah, that
versus like, whoa, that's scary.
that could go wrong really quickly in the world of social media.
I mean,
for
we're
sure,
a
for
little
somebody.
we're a little biased in this room, but I think the majority of people in America are still pretty
Yeah.
scared of chiropractors.
Okay, so let's talk about that.
Yeah.
We were going to talk about the misconception that still happens today. And so what I had said was that my assumption is that there's probably people who think that you're never going to get free of your pain and you're just going to keep going every week and
It's a
paying.
racket. Yeah.
Yeah.
Quacks in a racket is kind of like this.
Yeah.
Yeah.
What other misconceptions are out there that you'd want to debunk or like put people's minds at ease?
That it's unsafe, I think, would be like the first one. You know, I know somebody who knows somebody who knows somebody who ended up in the ER after an adjustment, which does happen. I mean, I'm not going to lie about that. But the okay, fun. You love fun facts. You
I
guys
do.
love who has the lowest malpractice insurance of any medical provider in the world?
What?
Really?
Chiropractors do.
Really? Now that's interesting.
Because we're the safest.
That's
Okay.
right.
And nationwide,
That's
you're
interesting.
looking at anywhere from it was 90 to 92% random study of anybody walking into a chiropractic office is satisfied and happy with the results that they're getting. What other medical profession can say they have a 90+% patient satisfaction
Yeah.
statistic?
good point.
It's wild when you
My
think
Botox
about it.
provider.
Right. Well, there you go. There you go.
We'll get into that episode next week.
So it is incredibly safe.
yeah.
That's it. Though.
Even though it looks incredibly scary, as long as you're going to a well-trained person who's thorough
Yeah.
in their examination process.
I took my tiny babies. Gabe was like,
Yeah.
you haven't met Gabe yet, but he was like 2 weeks old and he was having like colic and digestive issues. And I had this, he's a beautiful Dr. Dan Moselle in Chicago when I was living there. He's actually in Park Ridge and I still go to him when I'm there for work sometimes if I can see him because
Are you
he doesn't
cheating
just
on
do.
Justin when
I
you go to
would-
Chicago? Is that what you're saying?
I think that's what she's saying.
Remember, I'm not anti anything. I'm just pro chiropractic.
Aren't we? Like, are we going to?
I tell people all the time,
Yeah.
if you're an hour away and you can't make it down to see me, go see somebody you trust that's close to you. I'd rather have you seeing somebody
Yeah.
than nobody. Like, we're not that territorial
Yeah,
about it. I just want people doing well. But
I
the
didn't know
pediatric
babies
side,
were a thing. Okay, so
100%.
like I think that what is the youngest you've worked with?
19 hours old.
Oh,
Did you really?
What is
Yeah.
the
What was
story
the deal?
there?
Yeah, what did you do?
Saw the mom her whole pregnancy for prenatal care. It was her fourth child. She had a home birth. And literally the next morning, she walked in and
Aw.
handed me her daughter and said, "Adjust this baby." And then she got adjusted too. And I'm even like, "What are you doing here?"
No.
like,
Yeah, right.
Like, how
traumatic
tough
for
are you?
How are you walking?
How tough are
Yes.
you to get in the car and come see me 19 hours after? But it's very.
but
it was
why
very
did she
important.
think to bring her baby? And had she done that with the other
Yes.
three kids? And
Yes. It's-
and what is it doing? Like maybe because the baby squeezes through.
Yeah,
like the
even
obvious.
Well, childbirth's traumatic,
Very.
right?
Right.
For
Yeah, that's what I'm
mom
thinking
and
through now.
baby.
Yeah.
Yeah.
even the womb itself. So we go back to our CA Leah's pregnant right now, and we were
Yes.
talking about this yesterday, and she's like, "Hey, make sure you cover this stuff because she's like 3 weeks out."
She's
from-
so pregnant.
Yeah.
She's so pregnant.
so
I can't
excited.
believe it.
And she's petite, and I'm
But-
like,
So
she's
cute.
like a half belly.
Just tell her don't come in at
Oh,
19 hours, please.
I mean, I would 100%.
Yeah.
trust her. But even during the prenatal process, so we always say, okay, mom first, right? We're always going to be the place that's going to, because moms really, especially after the birth process, you have like your 1 6-week checkup and they're like, get out of here.
Bye-bye.
They're not supported very well,
Yeah.
especially postnatal. So I'm always chiropractor, pelvic floor therapist to what I would see as non-negotiables, even though it's really hard to do both of those after when you handle the new baby. But mom first. So pain, sciatica, pelvic function, next, all the typical mechanical stuff that moms go through carrying a baby. After that, it's also important to remember that the sacrum itself and the pelvis have ligaments that go directly to the uterus. So if mom's crooked in the pelvis, your uterus is not, there's tension there. And guess who has a tough time growing, moving, flipping, turning, getting in the correct position? Or you get a breached baby whose spine is developing without the proper gravity and positioning, and that's how they then come out, right? If they've been stuck or wedged in a certain position, that entire prenatal care, what do you think you're going to see right when they're born?
Do we live in a world where doctors and the nurses are bringing that up? Like, hey, your baby's breech. Here's something you should consider doing.
They do. A lot of the really good ones do. We have a ton of OB referrals
Oh,
now.
wonderful.
Oh,
Because
that's so cool.
chiropractors,
That's
and
good to know.
this is important too, we don't turn babies.
Okay.
That is not what we do. We
Yeah.
don't physically turn babies. That is not allowed under our scope of practice. We help mom's body and position and pelvis open so baby can turn naturally on its own. And the
Okay.
amount of ladies that come 3, 4, 5 weeks out and they're like, hey, we're breached. OB said, look into this, come do this. It'll up our chances of a baby turning naturally. And
That's
the amount of
good to
times you
know.
see it happen, it's wild. To
Yeah,
me
I mean, these
still.
are things I don't know that I find, I bet a lot of people don't know that I find really
But they're very
fascinating.
open to it. And then if a baby
That's good.
has to be turned, that's an OB's job to
Yeah.
put the gloves on. And that's not a comfortable process
No.
for any mom to go through.
What about sciatica when you're pregnant? I got that like the last couple
Or
weeks,
after?
I believe, I guess is what it was, or after. But like, I mean, I could barely walk in the last like 2 to 3 weeks. Is that something that a chiropractor can help with? Because at the
1,000%.
time I was told you just have to wait until the baby's out and then you'll be immediately
Oh,
relieved.
no, not at all.
Which did happen, but I was miserable
There's
for 3 weeks with Liv.
There's
Yeah.
a switch there. So the hyperextension that happens when you're carrying a baby is really tough on the spine, especially for any female that's already hyperlordotic or in hyperextension. So those joints just get jammed together while you're carrying the baby. Then you're not going to stay looking at the ceiling. So what do? Well, this comes forward too. So then you're in this hyperextended flexed position and that poor spine is just compacted all the way through. And then what happens
Interesting.
after you give birth to the baby? Your whole world is this
Oh, yeah.
for hours and hours. And so your back feels great, but your neck and mid back are usually a disaster.
Yeah.
And so we always prepare people like, get ready for this because you're going to need us to support you after too, as well as
Yeah.
as
Still
the
feel
baby.
that
And then
back pain.
to go
Oh,
back
yeah.
to the pediatric side, necks and shoulders getting hung up, the birth process itself is very traumatic. And so I always tell new moms, we look out for any baby that's favors one side and one side only, car seats, sleeping, and also that only wants to breastfeed on one side and not the other.
And that's
Oh,
the
interesting.
torta.
Similar, not necessarily
What is
like
it called?
full-blown
Torticollis?
torticollis, but if a baby has a little catch up there and can't look right without pain, they're not going to look to the right. So they're going to prefer to feed on one side and not the other, or be in a car seat going one way and not the other.
Okay.
And so, and if you leave those issues in a child as they grow and develop, you're usually going to see the compensation patterns that form. Like the most exaggerated of that would be a bad scoliosis issue because hips and pelvis. So there's stages.
Interesting.
Birth specifically, crawling, they need to be able to extend and support their neck. And then, of course, learning to walk.
Yeah.
How many times has a kid fallen on their butt a day? Like hundreds of times a day. And you think a pelvis isn't going to get
Yeah.
shifted a little bit out of place there and need a little bit of correction and support. And so,
That's so true.
Everybody asks, like, well, where does scoliosis come from? Well,
I did have that as a
Yeah,
question. I
yeah.
didn't know if it was genetic. I didn't know if it was from birth.
a combination of all of
Okay.
the things. I
Yeah.
mean, nobody knows for sure.
Okay.
Does it run in families? Yes. Is it always the same direction in families? No. It's opposite a lot of times, which is fascinating too.
Yeah.
And then traumas. Like when you
Yeah.
think about
Yeah.
just general kids being kids, falling off of bicycles, playing.
Yeah.
And if none of that goes corrected and we're not this perfect 50-50 balance, you're going to see compensation patterns. And it's better to catch them early
Yeah.
and let somebody like me fix them now then wait until 20s, 30s and go, oh, geez, now we're limited with how much we can correct some of this stuff.
Okay, so let's get into the modern technology of soft wave.
Yes, soft wave.
Let's
I'm
talk
glad
about
you brought that up. Yes.
Which I think I had heard somewhere. Did I tell you that I did it?
I watched her do it though.
Okay,
It was cute.
he
Cool,
was
isn't
nice
it?
enough to
Yeah,
have Christy like do it on my elbow, because essentially what I have, I guess, is like tennis elbow from doing hot works or something like that. But anyway, so we were in there and talking to her a lot about that. I think I'd heard Mahomes had did it. Is either she said that or
yeah.
whatever, and I only bring that up just because we're here in KC and he's
The
an
NFL teams
athlete.
have had it for a long time.
Yeah, so
Yeah.
talk about what that is, because I didn't know
Mm-hmm.
even what it was. Actually, I didn't know until Ashley Moore, a friend of mine, went to you and told me about it. She had really bad tennis elbow,
Mm-hmm.
which is how I thought, oh, maybe I should have them look at mine.
It's a really, really cool technology that came out of basically Germany and Switzerland. The Europeans, you know, they do all the cool stuff first before
Dang it.
big,
Yes,
before Big
they do.
Pharma allows it to come over here.
So true.
For sure.
And so it uses sound waves, which are actually called shock waves. There's these really high velocity, high intensity sound waves, but they're not necessarily painful.
No, I can
didn't
I
know.
can speak to it.
But it made your
Yeah.
hand shake like this.
It's a
which
pretty-
It was
kinda
funny,
cool.
yeah.
pretty
So I'm
wild
just
thing.
kind of like this on the pillow, and my hand would sort of go like that when she would
Like
hit a
the
certain
sound
point.
was like,
She said it was like a little hammer, like a tiny hammer.
It almost feels like a little electric
Yeah.
hammer. And we always tell people it pushes inflammation out from an area immediately, and you get done and you're like, what the heck did you just do? Mm-hmm. It brings 300% more blood flow to an area for faster healing times. And it also, that soft wave machine specifically triggers stem cell therapy. Your body releases stem cells from the bone marrow and they repair damage. The other thing that it does, we don't talk about this a lot, but it actually creates what's called angiogenesis in the body. So your body will create new capillaries and new blood flow over time and multiple treatments in the area that you're treating. So it's wild, the results that
Yeah.
we see with that thing. So that's our way of treating soft tissue injuries. If you come in with tennis
Yeah.
elbow, there's not a whole lot I can do to adjust
Right.
that specific like tendon attachment.
How many times
ankle
you-
sprains, hamstrings, knees,
Okay.
muscle aches, disc issues. I mean, we use it for dang near everything. It's awesome.
What would you tell someone to expect? I'm sure case by case, but like, you're not just going to go one time, right? You're probably going to need to go a handful of times or whatever. Like, what do you?
If you're
Set the
acute, if you're
expectation.
the basketball player that sprained his ankle in the season and you need to get back on the field as quick as possible, we kind of go twice a week as needed.
Okay.
If it's more chronic injury, an old tear in the knee, cartilage, a chronic tennis elbow thing, 1 to 8 treatments is typically the standard to get started to see a significant change.
Okay.
Full stem cell production, full physiological effects are seen between 8 and 12 treatments total.
Okay. Yeah.
Total.
And
Yep.
you had asked about like other things that it could.
I mean, I suffer from alopecia, androgenetic. And the way you talk about that sounds a lot like I'm wondering if it's ever been explored for alopecia. But that
Yeah, I
was
thought
what-
it was an
that what
interesting
I was talking
concept. Like
about.
what
I
else it
know.
could do.
Softwave themselves have,
I'm
I think there's
wondering-
40 some patents now that they have on their site. And it's
If
interesting
you're
too
stimulating
because
stem cells, right? It would be.
Softwave is the brand name.
Yeah.
And that's like the Ferrari version of the technology. There's a lot of other knockoff brands.
Like an El Camino.
Yeah. that like to borrow
Exactly,
they like
like
to
an alchemy.
borrow the research and kind of the technology for a lot cheaper.
Got it.
Are they
So
still?
they don't work.
Are they, yeah, they can do that.
They can still help
Yeah.
things. But anybody who's borrowing the research from the real
off patent, though, right?
yeah,
So they
yeah.
can,
And
yeah.
so it's
Yeah.
but it's like that with every machine ever nowadays.
Yeah.
And
Of-
from what I
of-
understand, are you one of the few around KC?
Yeah, there's a few of us around the Kansas City area that have the really nice machine
Okay.
that we believe gets it's just
so
incredible
cool.
results.
Yeah.
We see really cool stuff. And to answer that question, there are so many conditions. There's even like an entire you mentioned your Botox lady.
Oh yeah.
There's an entire in the esthetician world, like they're using it to treat
That's what I'm thinking.
like,
I'm like,
all sorts of blood flow issues, cellulite,
Yeah.
wrinkles. We don't do that. That's not
what?
really our
Yeah, I know.
jam. But
You
they're
can't come in and be like, fix my spine and my pros.
yeah, they're trying it for
Yeah.
everything.
shout out
And
to
one of
Camille
the-
at Holiday, everyone.
There you go.
One of the main Softwave guys is actually they've been really wanting to look at the research because of the angiogenesis in the blood flow for dementia patients.
Oh, okay.
Ooh,
ALS, Alzheimer's, Parkinson's.
really?
Yeah, because it doesn't do any damage to
Wow.
the cells. That machine doesn't damage anything. It
So-
mimics damage
That's
to
interesting.
create the healing process.
We have a really good friend who
So they're
was just diagnosed with ALS.
They're looking now at like, what can this thing do with the brain? Can it slow
Okay.
those things down? You know, like
Wow.
how can we use these types of technologies to
Yeah.
help us? Which is going to be really cool to see in the next 10
Ooh,
years or so.
we'll have to keep up with
Yeah.
that. That's interesting.
Well, sound therapy is also one of the oldest healing modalities
Yep.
ever.
Yep.
Yeah.
Like across time and space. So it's cool that it's been like channeled into this like 300 times the power you said, I think.
What are
I mean, 16 years, I've never brought a machine like that into a practice except for that one.
Yeah.
That's
Yeah.
and even if we stopped offering it for some crazy reason next week, I'd keep that thing for myself.
Yeah.
100%.
yeah,
Even though it's stupid expensive, I'd still keep it.
next year Ferrari in your driveway?
Yeah.
Yeah. What are things that we're doing like day to day at home? Some of them are obvious, right? Like we're hunched over on our phones and computers and stuff. But are there other things that we should be cognizant of to get ahead of inflammation or pain or whatever? Are there like day to day things that you're like, you can do this for free? You need to be better about. I mean, even my kids, you know,
It's
I'm
a
like,
great
you
question.
gotta sit up straight. You're on your iPad, right? It starts so early.
I know.
So
iPads and phones, and that's
the tech neck.
Yeah, and it's a wild thing because we haven't really seen fully what it's going to be doing to the adult spine because it's still relatively a new phenomenon. So I
Yeah.
have no idea what some of these kids' necks and discs are going to look like in another 30 years when they've started at 3.
Right.
You know,
Yeah.
versus most of us who were introduced to
right.
them later on.
Like us parents probably need to be a bit more proactive
it's
and
scary.
cognizant of that.
It's scary,
No
and
pressure.
I'm
Yeah,
as
I know.
guilty
Oh,
as
your kids are
anyone.
fun.
You know, like
yeah,
we
I
all.
can't control them anymore. They're on it all the time.
Yeah.
They're in college.
So anything repetitive, anything that you're
Oh,
doing
that's interesting.
many hours a day, multiple times a day, whether that's the computer work or the jobs or the phones or sleeping positions or, you know, I always get after the moms that are carrying baby on only the one side and never the other.
Man,
you
I
know.
don't miss those
this,
days.
This time
so
of year, it's
hard,
reminding the snow shovelers to like, hey, switch sides, buddy. Like 4 hours the same direction isn't going to be good
So true
for
to
your back.
everything that we do.
Little
Yeah.
things that become very repetitive throughout the day where the human body is not meant to be in that cycle
try to
of
stay balanced.
repetition.
Yeah.
We weren't really evolved that way or
Yeah.
looking down on
Right.
our phones and tablets too.
I want to quickly jump back. I was thinking of a friend of mine who had kidney stones that I think you had helped with. What are other things that people might go, oh my gosh, I didn't even think about going to a chiropractor or going to Dr. G. I'm suffering from XYZ. Are there other things we haven't talked about?
I think the most exciting one is fertility issues.
Yeah, I love that
Yeah.
you brought that up.
Yeah, that one is a really fascinating topic just to support the natural process of, you know, egg travels down a fallopian tube 1 month and then the next one the other month and it alternates, and every single little contraction of those smooth muscle cells, like swallowing your food, moves it along. So if anything is misfiring or not moving ideally, then the timing is off. So most of the time when people find me for that, and we have this running joke, there's a woman that's been seeing me for like all 16 years.
Wow.
And she's known a lot of women with success with that, but she's always running around and she's like, oh my God, you have to go see my chiropractor. He gets all these women pregnant. And we're like, maybe,
Let's rephrase that.
like, maybe we don't put it
That's a great
exactly
turn of
that
phrase.
way, but I love how excited
There's
you
a
are
documentary
about
for that. Yeah.
Oh my god!
But we-
Do you have like an amazing story? Like, do you have one of those
Oh,
stories of fertility of somebody like having a baby after doing everything and they couldn't?
Not
make it
only that,
happen?
I've had 2 that were born on my birthday.
Oh my
over the
God,
last
no
16 years.
way.
Yeah, I mean, like talking like
Fate.
we're talking like probably between 10 and 20 successful cases, just that I can
Did they
think
name
of
their
off the top
babies
of my
Justin
head.
and
I
Justine?
tried so hard. I've been trying for 16 years to
on.
get a Justin
Yeah.
or
This is
My
Justine.
baby doctor.
They
And
owe
they
you
all
that legacy.
laugh, and nobody's taking me up on it yet.
Yeah.
But talk about
Oh my gosh.
talk about a rewarding thing, because then there's so much trust there. I usually get to adjust those kids for years afterwards.
Sure. Yeah.
And so
I
these
always
little
see
like
families in
rainbow
your waiting
babies
room.
Yeah.
that come in.
Sweet.
And there's just a whole, and that's such a more and more common thing.
Yeah.
And almost every time that I see it in the x-rays, there's a pretty wild curvature in the lumbar spine and the low back where all of those nerves come from to support all of those
Oh,
processes.
interesting.
Yeah. You asked about things that you
Yeah.
see on the x-ray and you're like,
Interesting.
every time.
So you won't. Oh,
I've
man.
never seen a perfectly straight lumbar spine with fertility issues to this day. That's just me. That's my sample set size.
Does the lumbar in our cars do anything for us?
But it helps. Not enough. but it helped.
Well, I bring it up because my husband like cannot drive without that thing like.
Yeah.
And I am the opposite. I'm like, what is this? Like, deflate.
I always
So I didn't know if
tell
I'm missing out
people
on something.
that have that issue, like grab like a couch pillow from wherever, like Home Goods, or have like your car pillow that you can just throw back there for a little extra support.
Talk about making us feel real
or your
old.
plane pillow. It's not an old thing.
Get your throw pillow.
It's a structure.
Like
It's a
on an
structure
airplane. What can we do on airplanes to make that better
Same
for
thing.
us?
Same
Sit on a
thing.
pillow.
Yeah.
There have been. I've been thinking about it.
Get the giant pillow on Sky Mall.
With it behind you. Yeah.
sleep on.
Yeah, because anything that's in the low back, the small of the back, is automatically going to bring posture up. And more open.
Yeah.
Rather, it's this. Like this is the killer for all of
No,
us.
I feel like that's me as I get older
Or
too.
this.
And that's impossible in an airplane to not be that way,
my God.
especially if you're.
There was an older lady sitting next to me, and she had a neck pillow, and then she pulled it out from underneath her, and I was like, "Hey!" And she's like, "Works both ways on the neck and on the top and the bottom of the spine." And I was like, "Okay, girl."
You're like, do you know Dr. Justin?
I know. Well, she didn't have it behind the small of her back, so obviously she doesn't.
Yeah. What do you do as a chiropractor every single day? Like, do you wake up and have a routine, or before you go to bed, or in the middle of the day? What do you do?
For me now, I mean, I've had 5 major orthopedic surgeries already.
Yeah, we haven't even touched on that.
Most of them are sports related. They weren't like my job wear and tear. But I do know full well that the number 1 and 2 reasons that chiropractors retire are hips and shoulders.
Oh wow.
So, and even my best buddy growing up, his dad was my chiropractor, and I've seen him go through multiple knee and hip replacements. He's still practicing, but he doesn't get around very well.
Is this like the classic repetitive use because you
Yes.
are physically manipulating
We-
and it requires a lot? I mean, you do something with me where you have to twist my lower spine because I have a tricky lower spine, and you mentioned yesterday when Mindy was there that it's hard on the chiropractor also, and that's the first
It
time I
is.
considered that, and I kind of felt bad about it.
I want.
Like, thank you.
You're welcome.
Thank
You're
you
very
for
welcome.
thank you for risking. Like,
That's-
thanks for caring about my
You're very welcome.
spine so much.
So, and the technique that we used, you saw the table.
Yeah.
But you saw how tall it was. You saw the shape of it. I have everything set up in a way that's going to put at the minimum amount of stress on me that it can doing that every single day. And that's why I use more gentle techniques too, because I can have a much longer career
Oh, wow.
helping people without my
cool.
own
You
stuff
also only
showing
work like half a day. I always wondered about that. That's to manage your pain.
Yeah, we'd go.
Your energy.
We do the 9:30 to 12:30. We do 3 hours at a time, and then I take a nice long break at lunch, get off my feet, let myself recover, and then go back in.
Wow, I never thought about it being such a physical profession.
Not every chiropractor practices like we do at the volume that we do with the amount of patients that we do.
Yeah.
But even back when I was doing all the muscle work, like I could feel it in my thumbs by the end of the week. So
Are you
there's,
doing,
there's
like,
always a.
Stretches at home? Are you doing postures? Are you just walking? Are you like, what do you
I have a stair climber.
Okay.
That's I've had a big hip reconstruction done. My hip likes that. Otherwise, I'm just much more careful now.
Yeah.
You know, I did a lot of years of like really intense
Yeah.
working out that I'm
Slow it down a little
Yeah,
bit.
now I'm like, this is not as conducive
Yeah.
for
Don't
me
you
as
like
it-
lift weights
as it
with a
used to
neighbor
be.
or something?
Yeah, I go up and
Yeah.
see. I have 2 of my really, really good friends own the Alpha Collective, a really cool gym.
That's right.
And I told you you're gonna have to
Yeah.
bring them on too.
Yeah.
And so he was a college quarterback. He's had almost as many surgeries as I do. Just had another one for his knee.
Yeah.
And so he and I are in there. We call it our old man lunch hour, where we're like rehabbing our knees and hips and like doing our exercises,
Bonding over
taking
that.
care of ourselves. Yeah,
Yeah.
telling stories and just kind of shifted. You know, I turned 40 a couple years ago, and I was like, all right, I gotta make sure my body can last as long as I choose it to in this profession. I don't want to be forced to
Yeah.
not do this anymore. I want that to be my own decision. It's a great question.
Go ahead.
That just makes me think about your philosophy overall with treating people, and also just when I came to you being like, I'm trying to lift weights to build muscle, and you were like, some things you just can't do, Emily. You know, you were like, your goal right now is to like make it till be able to move as much as you can for the rest of your life, not like. And having been an athlete back in the day,
Yeah, you were.
It was like that's a hard pill to swallow.
It is.
So how do you get people like we think we should still be doing stuff, but what is the reality of aging and getting? What's your philosophy?
You know,
around-
I try not to tell people they can't do something. I try to encourage them to find the things their body likes to do. And that can just be shifting from really heavy back squats or deadlifts to more like single leg step ups and lunge steps and stability type things that you gravitate towards. And that's going to be different for all 4 of us.
Yeah.
Because my wear and tear and surgeries and your history and like our bodies are all going to like different things. There's no
your dancer
universal.
body, like all the hours
love
Yeah.
you spent dancing though.
Pilates.
We all have our own mileage, right? And that was what my hip surgeon told me. I'm like, dude, I'm 37. He's like, it's not the age, it's the mileage, buddy.
Yeah.
we all
like,
have
yeah.
our own mileage.
Yeah.
That is
So it's just
true.
what you've put your body through that you may not be able to get away with trying to lift 500 pounds off the floor every single week.
Yeah.
It's not that you can't do it. You can probably find a PT or a trainer to help support you in a way that you can do it. But at some point, I think we all learn what our bodies love and what our bodies absolutely do not love.
Yeah.
And I just try not to make mine do things it doesn't love unless I have to.
But I think that's a good point in a world where so many things are being pushed on you.
Yeah.
Like the
Yes.
latest trend or whatever.
Yep.
So
Also,
gotta
just
be
listening
careful.
to your own body, like we all need help with that, I think, and listening to our own guts and listening to our own intuition, and like usually it's right, like whatever kind of we like to do. That's a total flip of like all the being pushed things like of our culture.
Yeah.
Just like do this thing,
Yeah.
it's hard.
What you should be doing.
Jump on the bandwagon.
Well, Puritan
Yeah.
work ethic, hard work leads to success, right? Like the way we're founded in this country. And you to just say, it kind of blows my mind to hear you say, like, do what your body likes. Like, really? Is that okay? Is that all right? Like, is that really allowed? You know,
Yeah.
like,
Yeah.
No kidding.
And for me, it was, raised by a farmer that's just rubbed some dirt on it and never complained about anything. And
Oh, dude.
my dad's got his own mileage right now he's dealing with.
Yeah.
And I'm like, buddy, you
Bet.
should have taken a little better care
You're
of
from
yourself.
Beatrice, Nebraska?
Beatrice.
Beatrice. How many people live in Beatrice?
Oh, now maybe 12,000.
Booming. Yeah.
Okay.
Booming.
Wow.
Probably 13 when I was
Yeah.
there.
Okay.
One thing that we talked about over coffee, which you do not do, but I hadn't even thought about, is chiropractors for pets.
I adjust my own dogs, but I don't adjust other animals.
I hadn't even
in
thought
the
about
office.
this.
it.
But I have a couple friends that are really big into the animal chiropractic. The most popular are the horse people.
Oh,
Yes.
yes.
They
Yeah.
get their horses adjusted more than they get adjusted. Like I'm telling you,
I
it's
believe it.
wild.
You can adjust a horse
I know,
yeah.
right?
believe
I
it.
thought this was
Oh,
really
yeah.
interesting.
Whole
on like
thing.
a huge table.
Yeah,
What
like
does
big
that look like?
step stools and all sorts
Wow.
of. It's really cool. It's a fun rabbit hole to go down if you ever want to see
Okay,
it.
Poor
if
Bentley,
you're a
he could
horse
use it.
chiropractor, we got to get
Yeah.
you on the podcast.
One of
Maybe
my-
that's the TikTok rabbit hole we need
One
to
of
go
my
down.
good friends
Horse
down in
chiropractic.
one of my good friends down in Lewisburg, she still adjusts a lot of people's dogs, and like you'll see him limp in and walk out. It's completely unbiased, just incredible.
Well, we're in a
stuff.
dog-loving little sphere right here and in the studio,
Yeah, and
too.
like think all
so.
these little breeds that get all the disc issues and stuff that you see that can't walk or use their back legs and
Or the rescue dogs who've like literally been hit by a car and have one leg.
Man, I had
missing or something.
I had
you
a
know?
buddy years ago. He had an old tiny like miniature Chihuahua named Cletus. And he was getting towards the end of his
Cletus.
run, and he said, "Hey, come adjust Cletus." And I'm like, "Dude, I don't adjust a lot of dogs." He's like, "Just do it. It's not gonna hurt, like whatever." And I grabbed little Cletus, and he
bit you. And
no, he didn't, but like his low back like clunked in under my thumbs, and he screeched like I murdered the poor guy,
puppy.
and he hadn't walked in days. And he got up and ran out the door and like took.
I was gonna say, did you run off
and
crying?
took the biggest poop in the yard we've ever seen. And we're both just
Oh,
like,
no way. That's
we're
So
both
again,
just like,
it
whoa.
also helps with IBS, you mentioned.
Whoa.
Right.
So-
Yeah. Which
Yeah.
is like I
Yeah.
work in pharma.
I
you
hope
know, and
I hope
it's-
my buddy Jason listens to this because we still talk about Cletus.
We'll make sure it gets sent to him.
Yes.
Little Cletus.
But IBS is like a huge thing. What are the issues you find yourself treating the most besides fertility? Like I work in. I can't believe how many people seem to deal with digestive issues.
There are
Yeah.
lots of Crohn's and colitis and IBS
Yeah.
patients now, and we can help support whatever they are doing with their primaries, their MDs, if they choose to do that. But that's like the general nervous system regulation. And the physiology of the adjustment is fascinating too. And I could nerd out about this for hours. But if you were to, let's say, draw Emily's blood now, and then I adjust her, and then you immediately draw it again, and then another 5 minutes, hour, 3 hours, you would literally see the neurotransmitter changes, the endorphin changes. Every time you get adjusted, it increases white blood cell production for a short period of time, usually 3 or 4 hours. So it helps to fight infections. So I tell patients, like, if you're sick, come see me for your immune system support. Now, if it's coming out either end, stay home. You don't want me pressing on you. But there's an
Fair.
entire immune system modulation that happens with chiropractic. It's why a lot of parents that bring their kids in are like, I take my kids to the chiropractor, they're never sick. Or they're sick way less than the other kids that I see.
wow.
Now, there's probably other things that they're doing at home that are much more healthy choices that are helping that too.
But it is playing a big part.
But it's the physiology of the adjustment it's really wild.
Yeah.
So
It's
migraines
not-
and headaches, especially.
That was you.
Man,
what
I
got
mean,
you
this
there.
this week alone, I had a pneumonia case that came in that I caught and had to send out for. It was just like breathing and lung issues that had turned into pneumonia. I referred out 2 UTIs in the elderly population
that's
for
a
ladies.
huge deal too.
So I'm
that
learning
is a
how
deal.
big of a deal that is in
Referred
the
them
elderly
out.
community
It's
now that
why
our parents are
I
getting
catch
older.
it all
Migraines.
the time because they come in with flank pain and
I
kidney
was like, what do you
pain.
mean you catch it? Like, what does that mean? That
They come in and they complain about my back, and it's right over the top of their kidneys. And then I have to go, whoa, wait a minute, something's off. Or if it gets bad enough, it almost turns into dementia.
Yeah, you get like
They
my
get
mom had this crazy
very
situation.
confused.
That's so scary.
It's almost like, did you take like some pain pills?
Yeah.
Or so? They get slurry, they get
That's scary.
confused because the fever gets so bad. And the slips and falls that happen from the dehydration, it's very dangerous for the geriatric population to be running around with UTIs, and I catch them all the time.
So you've done 19 hours to what age?
98.
Nice.
98. Oh my God, that 98-year-old. His like second day ever. You talk about like meeting people the first couple times. He walks out with his 93-year-old wife. Still drove themselves to the office.
Robbing the cradle.
And this man walks out and sees like the waiting room just full of people. And he just goes, whoa. And he looks at everybody and goes, ambulance brought me here. Now look at me. And does like a little dance. And I'm like, oh my
goodness.
God.
That's great.
98.
What's his name?
One of my favorite people. Oh, I can't tell you that, but
Dang it, you're right. Can't.
one of my favorite.
Shout out to him.
One of my favorite people ever.
That's
98-year-old.
great.
Yeah, still drove himself to the office.
So fun.
Yeah.
Okay, so for people, because who your son, drawing a blank.
Johnny.
Johnny, I was about to say it.
Yeah.
Johnny wants to get into this.
He does.
Okay, so
Yeah.
for people that are interested in getting into this field,
Yes.
what do you kind of high level recommend? for
Oh
them
my gosh.
to do?
What do I recommend to do? First of all, go shadow different chiropractors
Okay.
now. So you can see the different styles and types and get a feel for like, am I going to love doing this? And spoiler alert, if you go into any successful, happy chiropractor's office and see the interaction with patients, you're going to be like, yes, please.
Yeah.
Because you will show up happy every day. You will leave happy every single night. It's one of the most fulfilling and rewarding
Wow.
professions you could ever get into. And it also provides an incredible work-life balance because I don't take
Yeah.
my work home with me.
Yeah.
You know, it's not
Oh,
like I go
that's
home and
huge.
plug in
That is huge.
every single night or I'm on call every single
Right.
weekend.
When you go on vacation, you're on vacation.
vacation.
You're not on your laptop.
And so I go shadow, see what you want to do, see if that's something that resonates with you, and then it's basic sciences.
Yeah.
Whether that's anatomy, physiology, chemistry, you can really major in any of those things that you want, and then you'll get way more of it once you get into school.
Any schools in particular, or really?
I mean, there's actually very few. I think there's only 10 or
Okay.
12 now across the country. And
Oh.
Cleveland Chiropractic College, named after Doctors Cleveland,
Where you went.
is here in Kansas City. That's
AKA
where I
the
went.
sledding hill.
Yeah, the hill.
Oh,
yeah,
okay.
yeah. You know, we used to borrow sleds in the middle of the day in like our shirts and ties and sled
Oh my
that
God.
hill.
You know, there's signs up
true
everywhere
story.
that's like,
Oh,
we
they
are
don't-
not
yeah.
liable for your
Yeah.
back injuries when
Yeah.
you fall down.
Oh, the kids sled that hill all the time. It's amazing.
If this occurs, call
Yeah.
Dr. G.
Yep.
Yes.
I've become very close
Just
with
slip your
Dr.
card
with
into
Dr.
your
Cleveland over the years, and he's one of the nicest men I've ever met in my life. Just one of the kindest human beings.
Yeah, isn't it one of the top schools in the country?
Yeah.
Yeah.
Yeah. Cleveland is amazing. There's a new one up in Omaha, and then there's another one called Life that's in Atlanta that are very good. They're all a little different. They all have a little bit of a different philosophy with what they teach, and also depends on the clinicians that are there.
Yeah.
But we're biased with Cleveland because I teach a lot of classes for the students in our office. And
Oh, you
stuff
do?
like that.
Okay, nice.
Yep.
so
Very
cool.
random question, but does AI make its way into your work in any capacity?
Yeah. I had a couple people over the last couple weeks that said like, I was having this and I was dealing with this, and ChatGPT told me I'm having suboccipital neuralgia. And there have been a couple moments where I was like, ChatGPT was right. So
Okay.
you did a good job. And they said, go to a chiropractor. We've had referrals from ChatGPT, which is pretty wild.
Oh,
that's
interesting.
That's
People get on there and they're like,
interesting.
who's the best chiropractor? Or where
Yeah.
do you live? And they like read our ChatGPT.
That's what I
reads
need.
it.
I need
Wow.
ChatGPT
Oh my
to be like, go
gosh.
listen to the Kansas City Bucket List podcast.
And then,
right.
and then my wife laughs because I always thank ChatGPT. I'm like, hey, thanks for the referral. Because if the world ever
great.
ends, they'll be like, that guy was nice to us.
Dude,
So, you know.
honestly,
That's
the machines are going to do that. But you know, it's like a whole bottle
Yeah,
of water.
she tells
every
me I'm
time you say
ridiculous,
thank you.
but-
yeah.
Other than that, I mean, AI has become pretty good at least.
well, it's become
kind of,
kind of
sort
a
of,
hot
right?
topic in the medical
Yeah.
field. So I'm curious.
Yeah.
Yeah. What?
I would imagine it will make its way into more of our software and note taking
Yeah.
in the future than anything, especially for us. But like, luckily, I mean, I joked with somebody recently. I'm like, I don't think I'm ever going to get replaced by a robot unless you want a robot adjusting your own neck, which I never would.
That would be
Oh,
interesting.
thank
We'll
you.
see where it
But
goes.
Something that they use in the medical field that I know, like in my world, they might put in scans and put it through AI, and then, or it's really more machine learning at that point, but like different scans of stuff would highlight what a problem might be. I mean, but that takes a bit of the human out of being like, and your study, but like, could they be like, oh, you might miss something, and it just allows you to double check and see what.
Yes, and this
compared to
really,
like millions of other scans, right?
This takes me back to the beginning when we should have talked about like kind of like our why with our office specifically. And I think we have really designed the office, and hopefully you guys have all experienced this, in a way to combat like the 3 biggest problems in modern medical offices, whether that's chiropractors, dentists, PTs, OBs, neurologists, rheumatologists. And what are they? What are the biggest complaints? Yes. And not only that, the disrespect for your time.
There's like no acknowledgement.
You may wait 2 hours and then you put in another room for an hour, and it's your whole day is just gone. And they don't. It's just normal. And they're never apologetic about it, unfortunately.
Right.
So yes, like 100% respect for a person's time, right? With a 5-star service is our huge thing. Also, I think the cleanliness of a space.
Yeah.
That
was
really
very recognizable.
Take a lot of pride in that.
Very clean,
very
pristine,
it's like a medical
clean
office.
lines.
I mean, that's our ladies do. They keep that place
Yeah.
spotless. It is theirs. It is very much theirs, and they do. And also with the service aspect of it.
Yeah.
And then just again the rudeness of the staff and how you're treated.
Yeah.
And it's rare these days to walk into a medical establishment and be treated like the most important person on the planet.
Yeah.
And we believe that you should be. You should feel.
And
like,
I was greeted immediately.
Yeah.
You know, when I walked in, and
That's how you
everyone
should
kept
feel.
checking. Yeah.
I know everyone's name.
I mean, if you're on my
They're like,
table,
"Hi, Emily."
if
I
you're
know.
on,
I was like, how do you know?
if you're on my table in that moment, you are the most important person on the planet to me.
Yeah.
Like that
Yeah.
is, and that's how you should feel. And they know your cars. That's how good those girls are.
Oh,
up front.
really?
They know what you
Oh my
pull
God.
out.
That's
in.
amazing.
Yeah. And they don't. There's no secrets. They just memorize everyone.
Yeah.
That's how good.
And they
they
are lovely.
And I also want, like you talk about AI.
Yeah.
I want, when you call, if you're going to make a new appointment with us, if you're going to call the office, you're going to talk to one of the ladies, because I want you greeted with that. I want you to feel the warmth coming from them, and like for us to be like, we can help you with this. I don't want you getting an answering service that never calls you back, or does call you back and you miss them, and then like you're just caught in this like
You get the human touch, like literally and figuratively.
There's no human in the loop.
Start to finish.
And I don't ever want that to happen with what we do, no matter how busy we are.
Right.
I want you to be able to speak with another human being who actually cares about what you need.
Yeah, love it.
Well, and I appreciate that you take walk-ins. I find that very
Oh, yeah.
convenient.
It's nice.
That is nice.
Do you do that?
No.
You have your standing appointment?
I do, kind of. I come like a little early on Tuesdays.
That you very much look forward to.
Yeah. Heck yeah. And when I miss it, I just feel it throughout my whole entire body.
That's what happened to me.
Yeah.
Because I was on vacation last week. So then when I went in yesterday, I was a hot mess. It came out much better.
Just momentarily.
When in the old style of practice where I was, spending a long time with patients doing more PT type stuff, you naturally kind of build a wait list where you can't fit people into the schedule. So me being me, it was work through lunch, stay late, come in on the weekends, because I felt horrible turning people away.
When did you switch that?
Oh, 10 years ago.
10 years ago.
Yeah.
Good
Yeah.
for you.
So
And I so we set it up where like,
Yeah.
we don't want to turn patients away. If you need us, when you need us, it's going to be in that moment on that day. And we don't want you calling and us being like, sorry, can't help you. Got to wait 2 days. Like nobody wants that.
I mean, I think the care we get when we go there is so great, but just why I wanted to bring my son in also when he was like, I think I might want to be a chiropractor. I'm like, well, here's how you should run your office if you have
Yes.
one day. Because it is like, I don't know, Melly, what you think, but I've never been in such an efficient process either.
Extremely
You guys talked a
efficient.
lot
Yeah.
about
For
that.
that.
Yes.
Thank
Very
you.
efficient.
Yeah, which I
Yeah.
just
Yeah.
like. Could we have more pressure on us to be in different places at different times and be moving so fast and like always be here? And anytime I'm here, I should probably be there. And so the fact that you do respect our time is like makes it quick in and out. And I don't. I
Yeah.
have it in
Like,
my work calendar. I have it blocked, and it's like 15 minutes the whole entire thing.
I want to make sure the mom with a migraine can go pick up their kid
Yeah.
from soccer and not have to wait in an office for an hour and a half.
Yeah.
Or not get an appointment that day.
Yeah.
So that just becomes really important to us to make sure we can help you.
This is so random. Last thing, and then we'll get into some fun rapid fire questions.
Ooh.
The guy, Alex, who just went up the building in Taipei, Taiwan. You know what I'm talking about?
Yeah.
Alex Honnold.
I was like, did he go to his chiropractor right after that? Did he go get adjusted after that? What does that guy do?
I would want him. I would want him going before.
Well, yeah. Yeah.
Because when it comes to performance, it's a great. I get asked all the time, like, do I come see you before I work out? Do I come see you after I work out? My personal philosophy is, if you're a runner and you're going to go run 10, 5, 26.2 miles. I want everything moving properly
Yeah.
before you go run. I don't want you.
Well, kind of like, or like a biker, like you compared the spine to like the bike chain that needs to be
Oh,
Yes.
yeah.
perfectly in line working.
Yes, I want
Okay.
everything moving and functioning.
Yeah.
So hopefully he went before.
I hope he did
Yeah.
too.
Yeah.
Although, man, that guy
What
is an
made you
outlier.
think
Yeah,
that
I'm
that
just
would
like-
mess up his back? The thing.
Not even mess it up, but like you climbed up an
Yeah.
8-story building or
With your
whatever it was.
hands.
Imagine
like,
how-
with your hands.
your
Imagine
hands.
how shot your nervous
And your
system would
legs.
be for like a week
That
after
guy
that.
But
is
isn't he
so
missing
unique.
a part in his brain that actually processes stress?
They
That's
did
what-
a
with
study on him.
scan.
Yeah,
Right.
Dan
Well,
was
you've
talking
seen
about
the
this.
documentary,
Yeah.
right? Yeah, it's amazing.
Without even
Oh
knowing,
my
I'd
God.
probably say, yeah, he's probably.
Yeah. Have you
He has,
ever
like, no
watched
fear.
Free Solo? That is like my favorite sports movie of all time. Sports documentary, Free
Yeah.
Solo. It's so good. It's on
So
Netflix.
good.
Yeah. Anyway.
Sorry, that was my last
That's
random
okay.
question for you. Okay, we're going to get into some rapid fire unless you guys have anything else you want to add about Dr. Justin Grabouski.
Well,
We've covered a lot.
I know.
So my daughter's also a patient. You
Yeah.
didn't know
Oh,
that.
no, I didn't know
think
that.
so.
Sweetest.
All in the
Isn't she
family.
the
She's the
best?
sweetest, yeah.
Yeah, she's spirit babysitter. I love
And she's
that.
a dancer.
Shout out,
Dancing's
Addie.
hard on a body.
Yes.
And so she
Dancing
needs-
is
yeah.
wild on a body. And again, like dancing,
I'm surprised Holly
gymnastics,
isn't going
cheer.
to Dr. Justin.
We'll
Well-
get her.
Crosby.
We'll get her
Yeah.
there.
I had to have
Get her there.
well, Johnny is a swimmer.
Yeah.
Like, hey, buddy, make sure you're breathing from each direction. Because imagine this recreational swimmers who look right every single time. It's just little things in
Back to
every
your, like,
in
dance.
every sport.
Yeah.
Yeah.
Most gymnasts, dancers, cheerleaders, like they're doing their I don't know exactly what they're called. I'm not that like
You're not a
their
dancer.
What is
their
it
round
called?
offs and their directionals and their
Jeté
twists are
Pierrot.
all the same. They're the same
talking about a
direction
lot
every
of
time.
Yeah.
They don't switch. And like the same dance
Typically,
routine,
the turns are on the
573 times practicing for nationals. Like you're going to create some wear and tear in some places.
I feel like now I'm going to go through life and I'm going to be
Makes
like,
sense.
oh, too much on the right side. I'm going to
know.
flip
I
to
know.
the left side. I'm going to turn into like a little bit of a crazy person.
You'll start to notice all the
Like,
things.
what about Bob?
All the things that you do.
Nothing like breaking a bone to realize, oh my gosh.
Yeah.
I've been using that other one. Yeah.
Yeah.
Okay, rapid fire him.
Okay.
I want to hear what you're
Alright,
going to ask
yes.
him.
I won't go through all of them because we have 3 of us, but what is on everybody's Kansas City bucket list right now? What do you want to do?
I want to go to Barbacoa and just eat
Okay.
tacos at Barbacoa.
Love it. That's a
Yeah.
great one.
I'm sure.
I am thinking about that. Are you thinking
There's
as
2
well?
things right next to the office that are coming up. There's a Vietnam cafe that's going to open.
I just saw
Yes.
that open.
and
I'm so pumped.
then Slow Rise
Pho.
opened. They did their
Oh, I
soft
know.
opening of their brick and mortar.
I had to
And I'm-
avoid the lines. I was like, I'll
Yeah.
wait until.
Yeah.
Yeah.
I
But
love
cannot
that we went
wait.
right to food.
But if anybody,
Oh, I know.
But if
I
anybody from Slow Rise is listening to this, feel free to come on down and meet your neighbors.
Yeah, there you
and
go.
We would love a box of donuts.
Wait, is that where they are? Right by
No,
you?
they're down the street away. So
Okay.
I'm just
Trying
trying
to
to like
remember.
exaggerate.
Yeah.
Just to, yeah.
Yeah, no,
But